Welcome back to 0 to PMHMP. Today we will be going over differential diagnosis. So a differential diagnosis, or just a differential, is examining the symptoms, ruling things out and ruling things in as far as potential disorders that it could be. So consider a list of possibilities, then diagnose. Like if you've ever seen the show House MD. So this is especially important in psychiatry because many symptoms may be misinterpreted as psychiatric, but they may be medical. So it's important to consider medical reasons when diagnosing. What labs might you want? What physical reasons do you want to rule out before diagnosing a psychiatric problem? Let's go over a potential patient, or like when you need to present a case to your professor. So the patient presents with worsening anxiety over the past 2 days. So what else would you ask about? What labs or tests do you want to do? So for medical reasons, I would want a TSH. This new anxiety is kind of concerning. I'd also want a drug screen because if we're talking about just 2 days, that's kind of weird, right? There's potentially alcohol withdrawal. Did they maybe recently quit smoking? From a psychiatric standpoint, I would want a GAD-7. And ask about panic attacks, what the anxiety feels like. Is their anxiety worse, or are they just having new panic attacks? And then for another medical reason, I would want an EKG to make sure that there isn't something cardiac going on, like SVT. So hypothetically, this patient has only had this anxiety for 2 days. We wouldn't be diagnosing them with generalized anxiety disorder, right? So those are also things that we need to keep in mind with our diagnoses as the timeline. Okay, next scenario. The patient comes in complaining of low energy and depressed mood worsening over the past month. What else would you ask about? What labs or tests do you want? So from a psychiatric standpoint, I would want to know if there's any history of mania or hypomania to see if we're talking about unipolar or bipolar depression. I would ask about sleep, and then I would want a PHQ-9 score or some other depression assessment tool like a BDI. I'd also want to check their TSH, folate, B12, and vitamin D to see if there's any sort of medical reason for their new depressed mood. So for differential diagnosis, make sure you're considering both psychiatric and medical diagnoses. From there, narrow it down. For boards and tests during school, they'll typically have it between 2 psychiatric options. So it's important to know the diagnostic criteria between similar diagnoses. So consider what physiological diseases share symptoms that may come across as psychological. So that anxiety, that could be hyperthyroidism. That depression, that could be hypothyroidism. Also consider the typical age of onset. Know your durations for your psychiatric diagnoses, and think about what disorders are similar to each other when you're considering your diagnosis. So in review, make a list of possibilities, rule things out, rule things in, think of everything it could be and everything it cannot be. Thanks so much. Please leave a comment if you have any questions or requests, and please take a moment to like and subscribe. Thanks.